Good afternoon, folks. I'm glad you're able to join us today for this week's Thursday Dairy Update. I'm Kathy Barrett with the Cornell Pro Dairy Program, and Pro Dairy, along with Eastern Dairy Business, offers these webinars every Thursday from 1 to 2 p.m. during the winter months. Today we're going to be talking about test day data and how to use it to manage udder health and milk quality. And we're fortunate to have Dr. Rick Waters with us to present this webinar. Rick went to school right here at Cornell, got his PhD, and now he is the Regional Director of Quality Milk Production Services and is on faculty at the Cornell College of Medicine. So, he's going to be talking to you today about how you can use your somatic cell and test day results to be able to maximize your milk production and your milk quality, et cetera. I will tell you that we're going to record today's webinar like we do every week. So if you need to review this or you have somebody else you'd like to share it with, you'll be able to do that in a week or two. I edit them and get them on our Pro Dairy website. If you have questions for Rick, go ahead and put them in your chat box, and at least by the end of the webinar, we'll take a look at those questions and get them answered for you. So with that, I'm going to go ahead and turn the program over to Rick. I just need to go ahead and pass the ball to him, so to speak. So there we go, Rick. If you would just go ahead and share your screen, you'd be good to go.
Okay.
There we go. Great.
Okay. We're going to get started. So thank you to Kathy and Pro Dairy for inviting me to give this talk. So we're going to go through using test day data to manage udder health and milk quality. And as you can see in the title, I've highlighted or bolded the word using. I think if it's information that producers are going to collect, they need to somehow use it in their daily management decisions. So we'll talk about somatic cells, what they are, and then we'll kind of start at the top and look at bulk tank somatic cell, individual cell count, and we'll look at new infections, chronics, high fresh infections, infections or cure rate during the dry period, and then how we can also use aerobic culture to, to build the whole puzzle and put everything together. As with anything, I like to try and get people in the frame of mind. It doesn't matter what aspect of the farm we're talking about. It kind of takes on 3 to 4 areas. We have people, and in this setting related to quality, I would also include the milking system, environment, and the cow. I threw a few examples in here, but in terms of cell count, udder health, where do people get involved? We can look at teat end cleanliness, the milking routine, if it's improper routine, and we have periods of low flow that can lead into damaged teat ends. If we look at the milking system, improper detacher settings, again, affecting the teats, and so on. We look at the environment, making sure we have properly groomed stalls, and then we can break it down looking at first lactation versus later lactation, and then what organisms. So kind of keep that frame of mind as we go through. It's about people, equipment, the environment, and the cow. Theory versus reality. So what is theory? Theory is a set of ideas that's intended to explain facts or that's possibly true. What is reality? Reality is the true situation that exists. When we get back test day data, we have a theory on why we think those numbers are what they are. When the cell count is 300,000, that's a one-dimensional value, and we can theorize why we think it's high. But in reality, we need to evaluate the situation. We need to look at people, the equipment, the facilities, and the cow to find out why that number is what it is. So really keep that in mind, that it's, when it comes to cell count, as with anything else, it's a hands-on approach to finding out how we can achieve a lower overall cell count. First line of defense with any animal or with the cow in terms of, I should say the cow, in terms of udder health is the teat end. When we look at mastitis, it's all about exposure and susceptibility. So even though there may be a high bacteria load, the cow may or may not get an infection based on susceptibility. And part of susceptibility is healthy teats, making sure we have a good teat end, that we don't have hyperkeratosis. So we need to keep teats clean and healthy, just so we don't, if there is that buildup of bacteria, there's a level of resistance based on, the structure of the teat. After we get by the teat, the next line of defense is the cow's immune system, or the somatic cells. Somatic cells is used as a matter of quality, and it's an indicator of mastitis. That's one thing I really want to stress is cell count is an indicator. It's not an absolute, it's an indicator of infection, and we need to take that to the next level to find out why that cell count is what it is. It increases with poor udder health. We have clinical and subclinical. I think we're all familiar with what clinical mastitis is. It's what we can see. It's flakes, clots, watery milk, maybe swelling of the quarter. In severe cases, it may be systemic, mastitis, where we're trying to keep the animal alive. But in all reality, that's just the tip of the iceberg. That's what you can see. Subclinical has, I would say, way more devastating effects on overall quality and the economic impact to the producer. You don't see it. The only way we can detect it is, by using a CMT, D. Laval cell counter, your monthly cell count, to find out what those values are. And I would say for every case of clinical mastitis, there's probably 15 to 40 animals that would have, subclinical, where they have an elevated cell count, but with no clinical signs. So how do we identify them? How do we work with those animals? This slide shows somatic cell count and days in milk of healthy animals. And I like to show this because the red is first lactation, the black is second, and the blue is third lactation. This just shows that early in lactation, right after calving, all cows have somewhat of an elevated cell count, and then it drops down. And then over the lactation, as they progress out to 300 days in milk or towards dry off, you'll see it start to climb again. So just shows you that we have to remember right at dry off and again at calving are our two highest risk periods for cows to get an infection. And just wanted to put in the linear score of a 3 and a 4. A linear score of 4 is a cell count of 200,000. So you can see outside of a fresh heifer, having a high cell count, just right at calving, everything is typically below 200,000 for all animals, out until we get beyond about 250 days in milk. So somatic cell and linear score. Linear score is just a log value of the somatic cell count. And each time the linear score increases by 1, the cell count doubles. We typically reference a 4 as 200, then a 5 is 400, a 6 is 800, and so on. I just put this table in to show you kind of where CMT values fall in and then where we see milk loss. I think it's very interesting the amount of milk that we can leave on the table just from a cell count of 200 to 400,000. It's 1.5 pounds per cow per day. So there's a lot of milk that we leave on the table when we have elevated cell counts. So what to do with test day results? We can open the results and file them away. We can move cows to a certain pen. milk them last. We can dry them off. We can identify the quarters that are causing the elevated cell count. Probably the simplest and least expensive way is with a CMT. We can then submit milk samples from those CMT positive quarters for aerobic culture, and then we can manage those high cell count cows based upon those aerobic culture results. And that's really what I'd like to stress today, that cell count, again, is just an indicator that there's an infection, and we need to find out, number one, what's causing the infection, and then once we know what's causing it, how do we manage that? How do we reduce the risk of that, contagious or environmental organism that's present? So for record analysis, as we go through this today, I'm going to use Dairy Comp. It's what I use the most often. It doesn't matter what program you use. You don't even need to use a program. You can do it by hand. The one advantage of using programs is it's just more powerful, quicker analysis. But it's really, when you get the results back, we need to do something with those results that you paid for. This just shows the QMPS menu within Dairy Comp. I've highlighted somatic cell count on this one, and there's multiple different options that can be set up to track cell count over time within your herd. So starting kind of at the top of the funnel, we get the bulk tank cell count. That's at the whole herd level. It's everybody. And we can analyze, we need to somehow analyze that. So a simple way would be to take a bulk tank culture and identify if there's contagious or environmental pathogens, just to get an idea of if there was a bunch of contagious pathogens in the bulk tank, we could say that the bacteria count is because of the cows, which also attributes to the high cell count. If it's environmental, we have to do a little bit more of an analysis. And I'll show you how we go through that using a flow chart to identify cows and then identify the risk factors, be it milking routine, hygiene, purchase cattle, et cetera, on why we're having that high cell count. Short-term solutions for a high bulk tank cell count is to dry off animals, separate them, treat or cull. The one thing that I want to say, though, that drying off or separating animals is good, but it's a temporary solution with no resolution. If you're just going to move cows to a pen and milk them last, you've reduced the risk if they're carrying an organism that could be spread by milking. You're minimizing that risk by moving them to the end, but you still don't know what that organism is. Same thing with drying it off. If the animal was positive for Staph aureus and you dry it off, the dry period may not actually eliminate the organism. So I still think it's important to always go a step further. As I said, I'm a proponent of taking these steps to mitigate the risk very quickly, but then we have to, keep working at it. Develop realistic goals. So we need to sit down and develop a goal. We're monitoring, we're measuring this cell count on a monthly basis, on, weekly basis with bulk tanks from the processor, but we need to agree on what our goals are and how we are going to implement strategies to achieve those goals. It's really important to make sure that everyone is on the same page when it comes to evaluation and monitoring, making sure that the goals that are set by the herd owner and the herdsman and the staff, everybody understands what they are and how they're going to be monitored. Here's test day average somatic cell count. This is one that I like to look at. Test day cell count includes all cows. And I think it's important to stress it's all cows. It's going to be higher than the milk that you're shipping because there's cows that are left out of the tank for specific reasons, and they're in this evaluation. This just gives you a good indication of where you're at on cell count on all cows within the herd. You can see here, for just in this herd, you know, the cell count was above 200,000, and then some management change may have been made. It could have been seasonal, and then over time the cell count went down. This is a flow chart that I use when I'm evaluating cell count to try and figure out if it's related to the dry period, during lactation, you know, fresh animals, and then is it more of an issue after that of treatment protocols because we have chronic animals versus new infections and so on. So as we look at this, our goal, like I would say for new infections, we want always to be 8% or less. I would say the same thing for chronic infections, about 8% or less. The top herds can get it down to 5%. Anytime we get above that, you know, 8%, 10% on new and chronic infections, we really need to take a look at what's going on. Fresh cow infections, if it's greater than 15%, you know, it puts up a red flag. If we look at this example here, you know, as we navigate through the contribution of individual cows, is there more than 2% of cows are responsible? And then this responsible for the whatever you've set for your goal. So if you set a goal for 200,000 for your overall herd cell count, if more than 2% of the animals are above that, then we want to keep working through this to figure it out. In this example, new infections were 8%, so I probably wouldn't go through the left side too far under that analyze heifers and cows to figure out if it was, you know, hygiene, milking procedures, purchased cattle, you know, was it environmental versus contagious? If we look at the chronic one, that's at 11%. So now we want to start going through and looking at this on a lactation level, maybe first lactation versus older animals. Look at, you know, culture these chronic animals, try and figure out what organisms are causing it, and then look at segregation, treatment, culling, so on. If we do go back for a second, just to kind of throw in what I would kind of break it down into contagious and environmental, if the new infections were above our goal. And we would look at, you know, if it was contagious, are there procedures related to the milking routine, equipment that's causing the spread of an organism, thus the high cell count? For the environment, we're looking at hygiene, biosecurity, susceptibility, again, making sure we have healthy teats and reducing that bacteria load. And then under the fresh cow, you know, infection, this is saying that 20% of animals are calving in with an infection. And that's one thing I should have stated here that I didn't, is what I consider a new infection in terms of a cell count is anything that was 200,000 on the previous test and at current test is now above 200,000. Or you could say it was a linear score of less than 4 on the previous test and now it's greater than 4. Chronics, same thing. We're looking at how many cows on last test were above 200,000 and this test are also above 200,000. And then fresh cow infections is just looking at how many animals calve in with a cell count above 200,000 or a linear score of greater than 4. This is somatic cell count by lactation group. So in the red, we've got our first lactation animals. In the blue are the second lactation, and then in the green is third and greater. And this is fairly typical. We would expect first and second lactation to be lower than the third lactation. It is interesting, you know, you can find certain dichotomies here. If we look back on the June test date in this one, for some odd reason, the fresh heifers had a very high cell count, and the cows, the second lactation animals, didn't. It could relate to heifers being on pasture prior to, you know, calving. It could have been very wet. Not sure, but this gives you the availability to look at this by lactation and kind of take a look at it. As you can see, though, over time here, as we move to the right, the cell count did go down for all animals. This is another way to kind of look at the same. If you're not into graphs and you like tables, this is the same analysis we just looked at, like with new infections, chronics. You can put them in a table and look at values and just see how the numbers change over time. In this one, it shows us that currently, if we look at the gray column, it's 8% chronic, 11% new infections as we go through. And actually, I see that I have that written wrong. It should, down below, it should say 11% new infections and 8% chronic, 20% high fresh. So just another way to look at it. If you're more of a numbers person instead of looking at graphs, here's another way to look at changes over time. This is another way to look at what we are looking at in the flow chart, and now in the last table. This has the red line is actually the new infections. The red bars are the chronic level, and then the orange line is the new infection for the fresh animals. And the blue line represents where we would like to see the chronic animals and the new infections below, and the top yellow line is where we'd like to see the high fresh below that. So in this sample, or this example here, chronics are right at 8%, new infections are down at 7%, and the high fresh infections are actually down at like 4%. So this is doing a really good job. Another way to look at new infection risk just all by itself, you can turn on numbers to look at changes over time. This is an example of a herd that has a very high new infection risk. So we would want to go in and try and figure out, if I saw this without even knowing anything about the cows, you would start having conversations related to anything related to contagious versus, environmental. So is it something going on in the milking center? Is it out in the environment? Stall cleanliness. We would also want to discuss the dry period and look at how many of these new infections come from calving and so on. Chronics here. So this is one where the chronics are, almost 3 times higher than the goal. And here we would look at, if these two were the same herd, this new infection risk and this chronic infection rate kind of go well together. We have a lot of new infections, which every time we have a new infection, we have an animal eligible for a chronic infection. We would want to look at, what are reasons why these animals aren't curing, in terms of why isn't their cell count coming back below 200,000? It could be related to treatment protocols, the environment, housing, multiple different things that we could look at. So there's a lot of options here, different ways to look at the data that you've been presented, just not looking at just the number. This is a graph of previous linear score. And this basically tells us in the lower left quadrant the healthy animals or animals that were below a 4 on previous linear score and are currently below. If we look at the upper left, those are animals that on the previous linear score had a cell count of under 200,000. Now they're above 200,000. And if we go to the upper right, those are the chronic infections. Those are the animals that we really want to look at. So they've been above a cell count of 200,000 or a 4 for an extended period of time. And we need to find out, like, why, you know, what's going on, why are they there. The one nice thing, if you have access to Dairy Comp, or if you can work with a consultant who can download your test day data, you can click on each of these squares. Each of these boxes represents an animal, and you can pull that animal up and not only look at their current cow card, but you can look at each test day for that animal and try to figure out what's going on. This is the econ command that I like to look at, and on the top on this one, this just shows the number of cows that are milking on the wavy blue line. The bottom darker gray line is the cell count, and then the gray line that kind of looks more like a heartbeat going up and down is mastitis. And if we kind of go through this, I put this in here because this is one, if you actually follow the cell count line at the bottom, as you see the cell count go down, you can actually watch the mastitis rate go down, and as it goes up, you can watch it go up. So it's a good indicator, can be a very good indicator of what's going on in the herd. This is another graph that I like to look at, and this is the estimated cow value versus the average linear score. And then each colored dot represents a cow, and the color is actually the number of cases of mastitis it's had. And cow value is the value of the cow compared to a heifer that would come into the herd. And I just like to put the line across here at 4 and at 0. But if you really look, when the cell count gets above a linear score of 4 or 200,000, there's actually very few animals, you know, compared to below that. So we have more value in animals in our herd if we can keep that cell count down below a 4. I circled the one blue dot there, and if you click on that, you can actually open up the cow card for that animal and look at what's going on with this cow. You can see here at 60 days in milk, it had a case of mastitis. It was identified to be strep uberis. And then if we go down and look at the test day records, in January and in February, it's, you know, 2 million and 8 million cell count. So it probably shows you why that animal is near 0 for cow value with such a high cell count. Okay, so now what do we do with this? We've kind of looked at the values, and we can say the chronic value is high or the new infection is high. We need to be able to pull out some animals and look at who are the contributors. So on this list, I just went in and looked at the top contributors to the test day somatic cell count. And as we go across, you can see the cow ID, the repro, days in milk, lactation. LS1 is the linear score, the first test day after the animal freshened. PLS is 2 test days ago, and LS is the current test day. And then we have milk, value, cell count, and percent of tank. These animals highlighted in yellow are chronic animals. They've had 2 test days with a cell count greater than a 4, or linear score greater than 4. Anything higher, highlighted in green represents an animal that calved in with the linear score above a 4. And if you actually go down and look, all but 3 of the animals, or 10 of the 13 animals that have a chronic infection, actually had a high linear score at calving. Now, you can go back to the days in milk column and look at, how long ago those may have occurred, but independent of how long ago that first linear score was compared to this current test day and last test day, I think it really says a lot here that we really need to make sure we prevent infections from occurring at calving. It seems to kind of turn on a switch and it sets these animals up to become chronic as they progress through the lactation. With this list of cows, I would definitely be working with, for sure, these chronic animals. And this is where I would get out a CMT paddle, use the California mastitis test, put a little bit of milk in each one of the quadrants and add the solution. And for each quarter that the milk coagulated or gelled up, I would collect an individual milk sample from each quarter that was CMT positive, and I would submit those for aerobic culture. Then, based upon the aerobic culture results, that's how I would manage the cow and start to manage the cell count. So it's time for culturing. As I said earlier, cell count is an indicator. So we need to find out, why did that change? Why did that value go up? And in my eyes, independent of the fact that I run a culture lab, it's so important that we know what is causing that elevated cell count. Even if we send in a culture from a CMT positive quarter and it's negative, it's still of value. We still can say, we took the steps to find out that we at least know at that given time there's not an organism present even though the cell count is high. And to me, that means that the cow's immune system is doing her job to get rid of the pathogen that caused the high cell count. So I often get asked about treatment, and should we treat animals that have subclinical mastitis. So I brought up an animal here, cow 2342, no visible signs of mastitis. She has a cell count of 452,000. She's CMT positive on the left front, and aerobic culture showed that it was positive for Streptococcus dysgalactica. Should this cow with subclinical mastitis be treated with an intramammary treatment? Obviously, we need to work along with veterinarians on this, but my answer is yes. An infection is an infection, even if there's no inflammation. I think one of the ways that we can reduce the incidence of chronic animals is going after some of these organisms that may be treatable. Now, if on this same animal, the culture result came back as Klebsiella, you would probably be advised not to treat it, just given that the cure rates aren't as great for Klebsiella as they are with Strep dysgalactica with an intramammary treatment. So I do think it's something that you have to have discussion with your veterinarian, but I do believe if you really want to use cell count data and try to get to the next premium level and reduce new infections and chronic infections, we need to find out what quarter it is, find out the organism, and then manage the cattle or the cow based on the aerobic outcome. The last area, kind of as we're progressing through the lactation now, is looking at the linear score at Dryoff and calving. And this is one of my favorite tables to look at. And if we look across the top, we've got the dry linear score. So that's the last test day prior to the animal being dried off. And then on the left, we have the first linear score. So In the upper left quadrant, those are animals here. There was 306 animals that had no infection at Dryoff, but they had an infection at calving. If we move to the upper right quadrant, those 13 animals had an infection at Dryoff and also had an infection at calving. If we move down to the lower left, those animals had no infection at Dryoff and no infection at calving. And then in the lower right, those animals had an infection at Dryoff and no infection at calving. So if we want to look at our dry period cure rate, we go to the lower right and we take those 24 animals out of the 37. So we had 37 total animals that had a linear score greater than 4 at Dryoff, and 24 of those calved in with a less than 4. So that shows 65% of the animals we cured during the dry period. Our goal would be to get that to 80%. The other one that we want to look at is new dry period and infection. So those are all the animals, the 306 animals that at Dryoff had no infection, and now at calving they did have an infection out of the 1,400 animals. So that showed that there was 21% of animals with a dry period infection, and the goal there would be less than 10%. And a bunch of these examples that I've used today are not all of the same herd, but you could build a story from this one where if there's 21% new infections in the dry period, it probably correlates very well to the example in the beginning where there was 20% of animals that calve in with an infection. This helps you to locate, where is that issue coming from? Is it actually we're not curing infections during the dry period, or are we causing new infections, or is it a combination of both? This is similar to the last table, and it's kind of like one I showed earlier, but this is, we have dry linear score on the bottom and then the first linear score on the left. And as we just kind of move through here, the lower left quadrant are all animals that are clean. They dried off with a linear score less than 4 and calved in less than 4. In the upper left, these are new dry period infections. So they got an infection during the dry period. In the upper right quadrant, those are chronic dry period infections. So they went into the dry period with an infection and they came out with one. And then the lower right are animals that the dry period cured. So again, the nice thing with a table or a graph like this is you can go and, the upper right quadrant, we can go and click on each of those animals if we want to learn a little bit about them and their history. You may find out maybe some of the chronic dry period infection animals have more major pathogens, maybe like Staph aureus or a Klebsiella if you have culture data, or maybe you'll choose, now that you see this, to CMT that animal right away at calving as soon as you got this information back and try and figure out what quarter it is and what's causing that chronic infection. A few things I wanted to just touch on, factors besides infection that impact cell count. It's pretty well documented that older cows, we see an increase in cell count, so the age does have an impact. We expect, third and fourth lactation animals to have a higher cell count than a fresh heifer. Stage of lactation, so later lactation, as we showed earlier, increased cell count. I put stress here, and I guess I mean more heat stress may impact cell count, but I think the data it's kind of twofold. It could be dilution effect from decreased milk yield, and it also could be immune suppression. These cows are, their whole metabolism and their maintenance to stay alive has switched and becomes a priority during heat stress. Stray voltage changes cow behavior, but there is no documented data anywhere that shows an increase or decrease in cell count. Same thing with estrus. I often hear that we expect that to take up the cell count. It does change cow behavior. Again, if anything, there may be a sort of a dilution effect just given the cows in heat and decrease in milk yield. So goals and monitoring, I'm big on setting goals and then monitoring it, so making sure we define it. We need to define, the goal is a cell count of less than 150,000. How to monitor that, we can look at bulk tank cell count, monthly test day data, and then we need to just keep breaking it down to get from the bulk tank level down to the cow, to the quarter, to the organism. And we can look at the chronics, culture results, cow cleanliness, T-den scores, and really when it comes to monitoring, it's all about finding the bottleneck. So what are the rate limiting steps to achieving your cell count of 150,000? Is it a specific organism? Is it stage of lactation? Is it purchased animal? So that bottleneck becomes a constraint, and you systematically make improvements or changes to where that constraint no longer exists, and you've achieved your 150,000, and now you're moving on to the next one. Part of that constraint and risk is risk, and just identifying those risks for elevated cell counts, teat health, hygiene, and we need to manage those. So in closing here, the priorities are to set a somatic cell count goal that can be monitored and evaluated. And then we need to analyze records either with a program or by hand, use the flow chart. If anybody wants the flow chart, let me know, I'll gladly provide it. New infections, chronic infections, again, and then we need to keep working down to the quarter level and manage it on the aerobic culture results. And I like to tell everybody that we need to manage the cell count, not the number. It's not that it's a cell count of 400,000. We need to find out why is that cell count. So, and again, moving a cow to a high cell count pen or drying her off is great for immediate risk management, but we still need to identify what caused that elevation. Develop protocols and use the flow chart, and then economics of low cell count is an additional milk shift, not just a premium. So the premiums are a big part of it, but as we touched on, if we can take that cell count down 100,000, we can be putting more milk in the tank. And with today's dairy economy, I think anything that we can put on the table is a plus. So, any questions?
So, folks, if you have a question, you can go ahead and put it in the chat box. We'll give folks a couple of minutes to go ahead and do that to get the question sorted out in their head and then type it in. In the meantime, we're giving folks a minute. Next week is our last Thursday dairy update, and Dr. Paula Ospina, who is also with Quality Milk Production Services, is going to be talking about bedding in bulk tanks and what to do with that information. And she says she has some data that she's just been able to kind of analyze and look at, so she'll have some new information for us. And that is actually going to be our last one for this winter season. So just kind of looking to see if we have any questions. Well, we do have a comment from George. It says, very clear and well organized. No questions from him.
Thank you.
So I just hate to, the last week I did this, I cut it off just when I ended the meeting, and just as I was ending it, somebody's question popped up. So I'm kind of just letting people have a second to add something if they would like to.
Okay.
Okay, we do have a question, Rick. It says, any comments on culturing versus PCR testing for mastitis?
I don't know if I have any comments. I think, so culture methods, like aerobic culture methods are, you know, I think are cheaper than PCR. It's another option that's out there. And I would say doing something is definitely better than nothing. So I think however you can identify what the organism is a positive over not doing anything at all.
Okay. Well, I don't see any other questions, Rick, so I'm going to go ahead and thank you for an excellent presentation. Really appreciate you taking the time to meet with us today and get this done. Oh, wait a minute. Wait, there is another question. It says cultures, question mark, chronic rate 4%, somatic cell 100,000. So I think there's mentioned culture.
So it was culture. What was the other part?
It says, like, cultures with a question mark, and then it says chronic rate 4%, somatic cell count 100,000.
So there's still, even with a chronic rate of 4%, you're still going to have 4% of the herd that are chronic animals. And I think there's value in finding out why those animals are chronic, especially if it's an organism, again, like a Staph aureus that could be transferred during milking time, or maybe the chronic animals are gram-negatives, E. coli and Klebsiella, so maybe it's time to review our coliform vaccination protocol. So I think there's still value if you go the step to identify the quarter, to submit it for culture and try and figure out what it is and manage it.
All right. All right, well done, Rick. Thank you very much. And again, thanks to all the folks who signed in today. On behalf of ProDairy and Eastern Dairy Business, we're very pleased that you took the opportunity to hear this presentation. I'm going to check comments one more time to make sure I'm not cutting anybody out. Nope, we're good to go. So again, thanks, Rick, and everybody have a really nice day.
All right. Thank you.